The human brain, a universe contained within the vault of the skull. It is a labyrinth of intricate pathways, pulsing with electrical energy, home to our thoughts, emotions, and very essence. This remarkable organ, along with the spinal cord and the vast network of nerves that extend throughout the body, constitute the nervous system. This system is our body's internal communication network, a symphony of electrical and chemical signals that orchestrate every aspect of our being. Imagine a vast, intricate tapestry woven with billions upon billions of threads. Each thread represents a neuron, the fundamental unit of the nervous system. These neurons, connected by synapses, communicate through tiny bursts of electricity, creating a constant hum of activity. Sensory information from the world around us, from the warmth of the sun on our skin to the taste of a ripe strawberry, is relayed as electrical impulses to the brain. The brain, in turn, processes this information and sends commands back through the network, dictating our every movement, thought, and feeling. This constant interplay, this intricate dance of electrical signals, forms the foundation of our conscious experience. It allows us to perceive the world, to learn and remember, to love and to dream. Yet, like any complex system, the nervous system is vulnerable to disruption. When these delicate threads become tangled, when the flow of electrical impulses is disrupted, the consequences can be profound. In the following sections, we will delve into the world of neurological disorders, exploring the ways in which these conditions disrupt the delicate balance of the nervous system. Yet, for some, they can be debilitating, a throbbing. While the exact causes of headaches are still being investigated, we know that they arise from a complex interplay of factors, including changes in blood flow, nerve activation, and muscle tension. Imagine the blood vessels in your head as a network of delicate pipes, carefully regulating the flow of oxygen-rich blood to the brain. During a headache, these blood vessels can constrict or dilate, altering the blood flow and triggering pain signals. Nerves, those sensitive threads of the nervous system, also play a crucial role. The trigeminal nerve, a major nerve responsible for sensation in the face and head, can become activated during a headache, sending waves of pain signals to the brain. The muscles in the head and neck, when tense, can compress nerves and blood vessels, contributing to the throbbing sensation we associate with headaches. The human brain is a symphony of electrical activity. Neurons, those microscopic messengers, communicate through a constant flow of electrical impulses, a delicate dance that underpins our thoughts, movements, and sensations. However, when this intricate electrical symphony is disrupted, the result can be a seizure, a sudden surge of uncontrolled electrical activity in the brain. Imagine a sudden, intense storm erupting within the delicate circuitry of the brain. Neurons, normally firing in a coordinated rhythm, begin to fire in an erratic and uncontrolled manner, like a lightning storm illuminating the night sky. This sudden surge of electrical activity can manifest in various ways, depending on the location and extent of the electrical disturbance. Some seizures may cause subtle symptoms, such as a brief lapse in awareness or a strange sensory experience, like a fleeting scent or taste. Others can trigger dramatic physical manifestations, including convulsions, muscle spasms, and loss of consciousness. Brain injuries, infections, tumors, and genetic disorders can all disrupt the delicate balance of the brain's electrical activity. Epilepsy, a chronic neurological disorder characterized by recurrent seizures, is one of the most common neurological disorders, affecting millions worldwide. Understanding the different types of seizures is crucial for diagnosis and treatment. Generalized seizures, for example, involve the entire brain, while focal seizures originate in a specific area of the brain. The specific symptoms experienced during a seizure can provide valuable clues about the underlying cause and guide medical interventions. The human brain, a complex and demanding organ, relies on a constant supply of oxygen-rich blood to function. Blood vessels, those intricate pipelines coursing through the brain, deliver a steady stream of vital nutrients and oxygen, fueling the brain's relentless activity. However, when a blood vessel supplying the brain becomes blocked or ruptures, depriving brain cells of oxygen, the result is a stroke, a catastrophic event that can have devastating consequences. Imagine a bustling city suddenly cut off from its power supply. Streets go dark, buildings fall silent, and the once vibrant metropolis grinds to a halt. Similarly, when a stroke occurs, the affected area of the brain is starved of oxygen and glucose, the essential fuel that powers brain cells. Deprived of these vital resources, neurons in the affected area begin to die, leading to a cascade of neurological impairments. The specific symptoms of a stroke depend on the location and extent of the brain damage. A stroke affecting the left side of the brain, which controls language and speech in most people, may result in aphasia, a condition that impairs a person's ability to communicate. A stroke on the right side of the brain, which governs spatial awareness and perception, may lead to neglect, where a person becomes unaware of one side of their body or their surroundings. Time is of the essence when it comes to stroke treatment. Thrombolytic therapy, a clot-busting medication, can dissolve blood clots and restore blood flow to the brain if administered within a critical time window. The nervous system, a complex and intricate network, relies on rapid and efficient communication between different parts of the body and the brain. This communication is made possible by nerve impulses, electrical signals that travel along nerve fibers, much like messages transmitted along telephone wires. To ensure the smooth and rapid transmission of these signals, nerve fibers are insulated by a fatty substance called myelin, which acts as an electrical insulator, similar to the insulation around electrical wires. In multiple sclerosis, however, the body's own immune system mistakenly attacks the myelin sheath, stripping away this protective covering and disrupting the flow of nerve impulses. Imagine a garden hose riddled with tiny holes, leaking water and reducing the pressure of the water flow. Similarly, damaged myelin disrupts the smooth transmission of nerve impulses, leading to a wide range of neurological symptoms. The symptoms of multiple sclerosis are as diverse as the individuals it affects. Others may develop vision problems, numbness or tingling sensations, or problems with bladder or bowel control. The course of multiple sclerosis is unpredictable, with periods of relapse where symptoms worsen, alternating with periods of remission, where symptoms improve or disappear entirely. While there is currently no cure for multiple sclerosis, various treatments can help manage symptoms, slow the progression of the disease, and improve quality of life. Section 6. A conductor's silence. The tremors of Parkinson's disease. Deep within the brain, nestled amidst a complex network of structures, lies a small but crucial group of nerve cells called the substantia nigra. These cells play a vital role in regulating movement, producing a chemical messenger called dopamine, which acts as a lubricant for movement, ensuring smooth, coordinated actions. In Parkinson's disease, however, these dopamine-producing cells gradually degenerate and die, leading to a decline in dopamine levels. Imagine a conductor's baton falling silent, the orchestra struggling to maintain rhythm and harmony. Similarly, as dopamine levels dwindle, the brain's ability to regulate movement becomes impaired, resulting in the characteristic symptoms of Parkinson's disease. Tremors, often starting in the hands, are a hallmark of the disease, a rhythmic shaking that can make even simple tasks challenging. Muscles become rigid and stiff, movements slow and difficult to initiate, and posture becomes stooped. Beyond its impact on movement, Parkinson's can also affect mood, thinking, and sleep. Depression, anxiety, and sleep disturbances are common among people with Parkinson's disease, adding to the burden of this complex disorder. Medications that boost dopamine levels in the brain can help alleviate tremors, stiffness, and slowness of movement. Diagnosing neurological disorders, those enigmatic illnesses that affect the brain, spinal cord, and nerves, often electroencephalography. Imagine a conductor listening intently to the music of an orchestra, detecting subtle dissonances and irregularities in the performance. Magnetic resonance imaging, or MRI, another powerful imaging technique, uses strong magnetic fields and radio waves to create detailed images of the brain and spinal cord. Unlike X-rays, which primarily visualize bones, MRI can reveal subtle abnormalities in soft tissues, such as tumors, strokes, and areas of inflammation or damage. MRI is particularly useful in diagnosing conditions like multiple sclerosis, where it can detect lesions or plaques, areas of damage to the myelin sheath that insulates nerve fibers. In stroke patients, MRI can reveal the location and extent of brain damage, helping doctors assess the severity of the stroke and guide treatment decisions. Section 8. Navigating the future new horizons in neurological treatment. The realm of neurology, once shrouded in mystery and limited by inadequate treatment options, is on the cusp of a transformative era. Advances in genetics, stem cell research, and our understanding of the brain are paving the way for innovative therapies that hold the promise of slowing, halting, or even reversing the progression of debilitating neurological disorders. Gene therapy, a revolutionary approach that aims to correct faulty genes, is emerging as a potential game-changer for genetic neurological disorders. Imagine a surgeon entering the nucleus of a cell, replacing a defective gene with a healthy copy, much like editing a misspelled word in a text document. While still in its infancy, gene therapy clinical trials for conditions like Huntington's disease and spinal muscular atrophy are showing early signs of promise. Stem cell therapy, another area of intense research, harnesses the regenerative potential of stem cells, those blank slate cells that can differentiate into various cell types. Scientists envision a future where stem cells could be coaxed into becoming healthy neurons, replacing damaged or lost cells in conditions like Parkinson's disease and spinal cord injuries. Beyond these cutting-edge therapies, researchers are exploring novel drug targets, innovative rehabilitation strategies, and brain-computer interfaces that could restore lost function and improve the quality of life for individuals living with neurological disorders. The journey ahead is fraught with challenges, but the future of neurology is brimming with hope. As our understanding of the brain continues to expand and technological advancements accelerate, we move closer to a world where neurological disorders, once considered untreatable, can be effectively managed or even cured. Section 9. A Symphony of the Self, Reflections on the Fragile Brain. The human brain, a universe contained within the confines of our skull, is a testament to the exquisite complexity and delicate balance of life. It is the seat of our consciousness, the conductor of our thoughts, emotions, and actions. Yet, as we have explored in this journey through the landscape of neurological disorders, this remarkable organ is also vulnerable, susceptible to injury, disease, and the ravages of time. Headaches, seizures, strokes, multiple sclerosis, Parkinson's disease. These conditions, each with its unique mechanisms and manifestations, serve as stark reminders of the brain's fragility, of the intricate interplay of factors that can disrupt its delicate equilibrium. Yet, even in the face of adversity, the human spirit, often fueled by the brain's remarkable capacity for adaptation and resilience, shines through. We have witnessed individuals overcoming seemingly insurmountable challenges, adapting to new realities, and finding ways to thrive despite the limitations imposed by their conditions. As we delve deeper into the mysteries of the brain, as we develop new tools to diagnose, treat, and ultimately prevent neurological disorders, we must also remember the importance of compassion, empathy, and a holistic approach to care. For behind every diagnosis, behind every symptom, lies a human being, a unique individual whose life has been touched by the complexities of the brain.